Oh, hi Marty. Hey, look, I've received this referral from your doctor that's concerned about these growing rough lesions over your face and on your forehead and the likes. Now, I appreciate they've probably been coming on for a number of months, and they're not bleeding, is that correct?
This one here is pink.
Pink, yeah.
I've got it all on my lip, which is sometimes I pick off, but it has bled.
Yeah.
Because I picked it. And there are a couple of other spots I'm noticing coming up here. I've got some veins. It's mainly I've been out of the water a bit and spent a lot of time outside without sunscreen.
Yeah.
And I'm 43 years old, and I'm finding just the last few years they've started to pop up.
To be honest, looking at these with the microscope I used, these show that there's evidence of sun damage. And you might have heard of the term, it goes by the name of actinic keratosis. Now, it's incredibly common to have these as exposure to sun damages our skin. I am fortunate to know actually your family, and I know that this runs in your father especially.
We love them, yep.
And having looked at your father, I know what the behaviour of these ones can be. We've had the experience over years that show that it's from these lesions that skin cancers can progress as sun damage accumulates in that area. What we know is that they never go backwards and become normal skin again.
Right.
Their behaviour is that they tend to advance over decades. But it's from these lesions that skin cancers can come.
So it'd be easy to put off treating them, I guess. I mean, it's not really causing me a lot of problem.
Well, yeah, you're quite right. You're bringing up what to do about them. We know that the rate of change is very slow and very low. And so it is a sensible option to even say, well, does anything need to be done at all? And that's decades ago, that used to be quite reasonable.
Right.
And then you think, well, what's the least aggressive treatment? As GPs still do it now. Quite frequently they can freeze these lesions, and you may have heard of that, freezing them.
I've had a couple frozen off as well, yeah.
The whole idea is to actually kill those cells and allow new skin to regenerate, to grow back. Because I did say earlier, these will never go back to being normal skin on their own.
Right.
So leaving them is a sensible option. Freezing them, although it's very common, it's not as successful as newer treatments these days. And also on the face, I prefer to avoid it completely because one is people tend not to be aggressive enough when they freeze it.
Cutting, you doing that?
Freezing.
Freezing, right, yeah.
And secondly, they can heal with scar tissue and pale spots.
I think we're thinking about burning my face off.
Yeah. Well, there's newer treatments. Burning is a funny term to use, but the newer treatments are applications of cream which are toxic to the skin. They kill the skin, they burn the skin.
Right.
Now, there are a number available. Some of them are known to be chemotherapy, meaning killing cancer, and some of them are physically burn the skin and allow it to peel off and then heal as new skin. And then those options are available. They're all very successful, far more so than freezing.
Right, okay.
There's some treatment options which can't be used around the eyes or the ears, and for these sort of lesions you tend to go towards surgery first. But looking at you, surgery will be far too aggressive for what you've got. It's not needed.
Yeah.
So you're looking in that sort of framework of applying creams.
Okay.
And what's the best amongst that group. Now, there are some creams that take a month to be effective and then healing, and yet there are newer creams where you apply them and you add a treatment, which is light,